Good afternoon, everyone. Thank you for joining our Maternal Infant Health Hub's Policy Spotlight today. I'm Armini Pierre-Jacques, Program Officer at the New Jersey Healthcare Quality Institute. I'm also joined by my colleague, Kate Shamzad, who I will let introduce herself.
Hi, everyone. Great to be here with you today. I'm Kate Shamzad, Director of Policy at the Quality Institute. Back to you, Armini.
Great. Please feel free to introduce yourselves in our chat box by stating your name, your role, and your organization. To provide some background, the Quality Institute is a nonpartisan, nonprofit organization whose mission is to improve the safety, quality, and affordability of healthcare for everyone. The Quality Institute launched the Maternal Infant Health Hub in partnership with the Burke Foundation to serve as a learning collaborative that is dedicated to amplifying midwifery practice in New Jersey. The MIH Hub hosts these policy spotlights with the intention of bringing together midwives, midwifery students, and other healthcare leaders such as yourself to discuss best strategies for advancing midwifery here in New Jersey, as well as providing a deeper learning on policy issues that affect maternal child health. For today's session, we're going to focus on federal midwifery legislation. So we'll be hearing from our guest speaker, Jill Wodnick, who will be presenting. During the presentation, we will also have a Jamboard for all of you to interact with. Our Jamboard will be a space for you to post any thoughts that resonate with you during our presentation, and it's also a space for you to post any questions that you may have for our Q&A segment. So please post any questions or thoughts that you may have throughout our presentation on our Jamboard once we make that link available in the chat box. Please also note that after today's meeting, all of you will be asked to take a very brief exit survey to assess your knowledge about midwifery after attending the session. So please be sure to take that survey. With that said, I will hand it over to Kate to introduce our guest speaker.
Thank you so much, Armini. And I'm just really thrilled to be here today to introduce Jill Wodnick as our guest speaker for the content today. Jill Wodnick is a maternal health policy expert focusing on improving maternity care. Her policy and advocacy work has included invited legislative testimony, medical grand rounds, and community education on respectful, equitable maternity care. As the past chair of advocacy and collaboration with Lamaze International, she has partnered for federal policy changes, including breastfeeding equity, paid parental leave, and early relational health. Currently, Jill teaches free prenatal Lamaze childbirth education for Montclair State University. I am just thrilled to turn it over to Jill. And Jill, I want to maximize your time with us. So thank you so much for being here today as our speaker, and I'll hand over the microphone to you.
Thank you. Thank you so much to everyone at New Jersey Healthcare Quality Institute for this conversation. I'm so honored to really recognize where we are in maternal health landscape in the United States and the opportunity to have a deeper dive into the midwifery model of care. So I hope that you can just find your breath, find your seat. This may be your lunchtime, and it also just may be a really opportunity time to build community with the people here who are showing up and committed to high value, respectful, and equitable maternity care. I start with the complexity of how do we talk about federal levers on maternal health, specifically midwifery, and holding birth as a rite of passage, birth as a key life event amidst policy, resolutions, legislation, and federal funding. It's with this complexity that I'm wondering if we can all take a breath together, and you might even join me, just kind of grounding yourself, just rooting yourself and being here. Because it is this work, right? Walking between worlds of policy, advocacy, and attention to detail, and never losing the heart of giving birth and being born. I'm going to use the words of poet Amanda Gorman, who reminds us that hope isn't something we possess. It's something we practice. And perhaps this will be a framing for our conversation today. May this be the day we come together, mourning to mend. Withered we come to weather, to leave the known and take the first steps. So let us not return to what is normal, but instead return to what can be. And I feel that this is where we are with midwifery and maternal health right now. We have this plurality of experiences and so much need for scaling up midwifery compared with every other country in the globe where midwifery is the normal standard of care. The United States, it has been marginalized. So the consensus about midwifery, and you can look at some of the organizations listed at the bottom of this slide, is that midwifery is high quality, comprehensive maternity care for low risk pregnancies, trained to support physiologic birth, centering on trusting relationships, shared decision-making, and personalized care. Research reminds us that access to midwifery care is correlated with improved outcomes for families. In short, expanding the availability to midwifery care is cost-effective. I wish we could just stop there. If we know something works, why can't we implement it? And here is the challenge. So we are going to be talking about the implementation and investment in American midwifery. And there's a lot, and I'm going to be time sensitive. So I'm going to show you just these images, these infographics almost, that will help guide us through this conversation. I'm going to use 4 different markers to talk about the pillars of federal investment in midwifery: reports, resolutions, federal funding, and legislation. And because there's a lot, so hopefully we can just have that as a visual organizer as we go through. As I was preparing for this presentation, the US News and World Report about a month ago, May 14th, 2024, ran a commentary. And this is a screenshot. American hospitals are failing expectant mothers. Midwives offer a solution. This is not an isolated incident. If you pay attention to headlines on maternal health, especially midwifery, which I do on my Instagram, you will just see in any week, you might see a plurality of headlines because there is so much to discuss, excavate, and report on when it comes to midwifery meeting its moment in the United States. Some of these headlines deal with financing. Some of them deal with legislation. We could have a whole conversation about legislation that happened just Friday in Massachusetts and what's happening currently in Hawaii, and we should have those conversations. Headlines have talked about the history and marginalization, the impact of racism on American midwifery, and the need for midwives. And this is just on 1 week, right? So we can go even further, looking at reports, looking at all the ways that Call the Midwife has been a call, not just from a PBS show, but into the narrative for consumers and policymakers in the United States. With all those headlines, though, very few of the headlines have gone in depth into midwifery education. In other words, the workforce and capacity building. And yet it's this challenge, it's this complexity that I want to spend a little moment on before we go to the 4 pillars of investment. One of the articles, and you're going to get a copy of these slides. Armini will mail them out and email them out, and they'll also have the links at the end. So one of the articles that you can read, and this is a direct quote from, recognizes that American midwifery education is systematically disadvantaged. The article explains that obstetrical medical education is financed by the US government, whereas midwifery is not. Hospitals get reimbursed by Medicare for training physicians, and that typically is not the case for midwives. And hospitals have an incentive to train physicians rather than midwives. A quote from Susan Altman, who was the director of NYU in this article, explains residents, medical residents, get paid salaries that they can pretty much live on in order to go to school and work, but midwives don't get any of that. The article goes further. To complete 1,000 hours of clinical work, student midwives must pay for their own preceptors. And when you read this article, each midwifery school that the journalist is speaking about is noted and linked there. Student midwives also pay for travel and lodging out of pocket, and required midwifery clinical placement opportunities are sparse, even among hospitals attached to universities. So, why does this matter? Why does going into a deep dive? Well, let's look at a report. There is currently a maternity care desert as defined by the March of Dimes. A report recently from the Center for Medicare and Medicaid Innovation explained that the ratio right now is 11 OBs and 4 midwives for every 1,000 live births. Less than 50% of rural counties have a hospital providing obstetric services. This report is just one of the pillars of federal investments in midwifery. So here we are, June 2024, holding birth as a key life event, holding the urgency of making sure that midwives get to practice at the full extent, and holding the complexity of midwifery education. With all of the interest in consumer demand, what is happening at the federal level for midwifery? So here we go. We have reports, resolutions, federal funding, and legislation. Let's take a quick look. This report came out a year ago, and it's really significant because it's the United States Government Accountability Office, and it's simply called Midwives, Information on Birth, Workforce, and Midwifery Education. And I'm going to ask you to look at who requested this report. Some of these congressmen and women, you're going to see their names in a few slides when we talk about legislation. But this report became a needs assessment. And when you read it, because you'll have the link to it, you'll see that they have infographics. And some of the infographics telling the urgency of making sure that our midwifery reflects the plurality, the racial diversity, and the inclusion of our country. Midwifery has, as currently practiced, is much more of a historically white workforce. And there is an urgent need to make sure we have cultural, racial, and linguistical inclusion so all families can get a midwife that reflects their experience. The report also recommended that there be investments and that there be a reimagining of midwifery, partly because of the challenges. This report said there's challenges to obtaining midwifery care for consumers and challenges to providing midwifery care if you're a midwife. Both of those require longer conversations, but I want to just plant the seed of what are continue to be emerging as needs. Okay, a second report that came out this past year is from Medicaid in terms of MACPAC. And this report is specifically on access. It's interesting to note that in this report, and you're going to see this in future legislation, midwives and birth centers are paired together sometimes, partly because midwives can work in community settings, birth center settings, and hospital settings. And again, there's a real consumer interest in this. This report became really important. So go into the weeds for a minute and just look at what this report said. There's a lack of payment parity for midwives based on where they are providing maternity care. And the payment models, especially in Medicaid, may not compensate for the breadth of services, recognizing that the midwifery model of care is a model of care, and it doesn't always work with the shorter visits and how the financing models were designed. In addition, there's transfer issues to make sure that if a client needs to get transferred to a higher level birthing facility, that payment makes sure goes to the facility and the provider. So that was you can read that report, and those become really important. One of the other things we are holding when we look at federal pillars are not reports, but are in fact resolutions. So resolutions become an oral archive and written into the record. And I like resolutions because you can literally hear them. They are read on the floors of Congress. They go into the permanent record, telling part of the story of midwifery. This past March 14th, Senator Cory Booker and Senator Butler put a Senate Resolution 588 recognizing March 14th, 2024 as Black Midwives Day. You can read the entire resolution, and I encourage you to do so. It documents the trauma and racism that Black midwifery has endured and continues to endure, and recognizes this key moment for congressional acknowledgement. This was happening at the US Senate while the National Association of Black Midwives were having a conference in Virginia. And so important that there was roles for coming together in coalition as well as the resolution. So here's, it didn't just happen in the Senate. We also have the US House of Representatives, and Representative Gwen Moore and Representative Alma Adams made a House Resolution 1083. And this House resolution also recognizes the invaluable contributions, that's what it says right there in their own words, of Black midwives to maternal and infant health in the United States. So take a look at this. This is an important way of telling the story of midwifery federal pillars. We've had reports, we've had resolutions. But show me the money, right? Show us where we go from salutations and acknowledgements moving into implementation and action. And so this is the role of federal funding, sometimes called appropriations. So here's one that you may want to watch next month in July of 2024 through the US Senate. There's a possibility that the National Defense Authorization Act may create a pilot project to promote access to CPM care, in addition to services covered by CNM for military families. And you'll see TRICARE. TRICARE is the insurance used by our military families. So that's why this is in the National Defense Authorization Act. There can be a deeper dive on that, but I just want to show that that may happen or it may not, right? So that's the issue with appropriations. We do know that there was federal funding and one that continues to come into all states for maternal health. But I want to highlight this one because this is in Rhode Island right now. This is with the Rhode Island School of Midwifery to create a cohort through Jenny Joseph's model in Florida. The Common Sense School of Midwifery is being funded to do a Rhode Island pilot through HRSA, and that's at the federal level, and HHS as part of their maternal innovation grant. The focus is on expanding the cultural and racial diversity of the CPM workforce in Rhode Island, as well as strengthening the CM and CNM workforce. So that's some really interesting uses of federal funding, and I hope other states take note of this. The other big federal funding is going to be officially documented and released in 2 days. And this is a first time. This is through CMS, so that's the Center for Medicaid and Medicare. It's going to give up to 15 states a 10-year financing for the state Medicaid office to have a model, and government like to use a lot of abbreviations. So this is TMAH. And this was announced a few months ago that it was coming. There's a website for TMAH. This is their infographic. And I'm bringing it up here under our conversation about federal pillars for midwifery, because this is federal dollars that will go to up to 15 states. One of the most explicit goals is increasing access to midwifery for families and consumers. So This was announced a few months ago that it was coming, and then the specifications, what the deadlines are, all of the stakeholders that would come together. There's going to be a big announcement 2 days from now on June 26th. So be on the lookout for that. And that would be through each state's Medicaid office. So if you're here not as a midwife, but doing any auxiliary work, if you're here as a doula, if you're here with maternal mental health, if you're here doing patient navigation, you can, make sure that your state Medicaid office knows about your work in whatever role, because this is about a whole person approach to pregnancy, childbirth, and postpartum care. And that's the language that this grant is using. So they need to make sure that when these dollars come through, and this will be for 10 years, that this is a partnership for accessing services for whole person pregnancy, childbirth, and postpartum care. Okay, now let's do the final pillar of federal investments in midwifery this season, and that's legislation. There's a lot to say about federal legislation, partly because we've had more interest in general in maternal health. There's about 53 bills right now in the 118th Congress on maternal health. Many of them, not all, but many of them recognize midwives, or in some capacity have some implications for midwives. There's a high interest in maternity care, but there's really diverse initiatives with legislation. And sometimes there's competing political aims. And currently, I'm going to show 2 examples that have low bipartisanship, but then a few that do have bipartisanship. So first of all, let me just read out a couple of names: the Connected Moms Act, the Care for Moms, the Mommies Act, the Mama's First Act, the Stand with Moms Act. So I could keep going. And that's just like currently in the 118th Congress. And so that can be really complex and confusing to a consumer, to a policymaker, even to a legislative aide. So making sure that you know the bill number that you're referring to becomes very important. And it also is important to know, is this a bill that has been introduced in both the US Senate and the US House of Representatives? Because that usually, and there's going to be timing with that, but that's we need to make sure that both houses, both chambers, have introduced bills. So let's just take a deep dive, and let me just show you an example of language, because remember those like 5 or 6 bills that sound very similar? All right, let's look at the Mama's First Act. It came out about a month ago, meaning it was introduced. It was introduced by Representative Gwen Moore and Senator Elizabeth Warren. So look, it has both houses. It has the US House of Representatives and it has the US Senate. And so what the Mama's First Act would do would amend the Social Security Act to provide culturally congruent midwives and tribal midwives to the list of eligible providers in Medicaid. So really interesting. The Mama's First Act linguistically sounds like the Mama's Act. But when you read the Mama's Act, which is S4296, and you read the actual bill, they couldn't be more different. So the Moms Act, and I'm going to read you from the bill, has nothing to do with financing providers. It's this, and you can read this legislation. This came out in May of 2024. Senator Kate Britt and Marco Rubio and 10 Republican senators put together a bill. This is proposed to launch a website with resources related to pregnancy, including information about adoption agencies, but not abortion clinics. It would provide grants to anti-abortion elements. I want you to know the language, because we really see in a post-Dobbs era the structure of how what could sound very similar, which is the Mama's First Act, is totally different than the Moms Act. And you're here with your own agency and autonomy as a voter, but I want you to understand this is why we have to take a close look at what legislation is impacting maternity care and really make sure that we're alert and aware, because bills can sound very, very similar. So here's another piece of proposed federal legislation. Last week, the SHINE Act, and SHINE is an abbreviation for Stillbirth, Health Improvement, and Education for Autumn Act of 2023. If you're here from New Jersey, you know that there's a family in New Jersey who is deeply, deeply dedicated to this advocacy. So the SHINE for Autumn Act is bipartisan. And just last week, it passed out of the House Energy and Commerce unanimously and now awaits a vote on the House floor. And getting out of committee and being able to get a vote is what a lot of partisan pieces of legislation have not yet been able to do. So I want to highlight this not only because there's a New Jersey connection, but the legislation is being championed by Representative Young Kim, Kathy Castor, David Joyce, and Robin Kelly, along with 90 US representatives. And so when I said those names, I want you to see who is leading the co-chair of the Bipartisan Maternity Care Caucus. The Bipartisan Maternity Care Caucus is now for the 118th Congress, led by Robin Kelly and Young Kim. And the goal is to work with bipartisan legislation. And so what happens if a piece of legislation is partisan? I think that's kind of where we need to really look and examine. So here's an example of a really important bill called the Momnibus. It's more than one bill. It's a series of bills. And if you're calling in from New Jersey, you may have seen Representative Josh Gottenheimer last week at Hackensack University Medical Center. I can, show you that you can watch it on New Jersey News. He was talking about the Momnibus, right? Because it is that comprehensive and important. Things from data to the workforce, to technology for rural areas, social determinants, expanding breastfeeding and WIC. And so it's a series of bills. And unfortunately, it's not moving, even though even as of last week, we have congressional champions. So it's something that we just want to really observe. And we want to make sure that we are understanding, what does this mean for midwives? Well, for midwives, which is, part of this ecosystem, there is a proposed piece of legislation, first introduced in 2021, reintroduced now for the 118th Congress. And this is bipartisan, House and Senate. I will tell you, our own Congresswoman, Bonnie Watson-Coleman from New Jersey, was one of the lead sponsors, along with Iowa's Ashley Hinson. And so there is diverse clinical and advocacy organizations that are supporting the Midwives for Moms. So let's go a little deeper. And what is this midwifery bipartisan legislation? So we can understand that it's supporting midwifery education for all three pathways of certified nurse midwives, and certified professional midwives, establishing two new funding streams through Title VII and Title VIII, and acknowledging and addressing the lack of diversity that has been in recent midwifery education, and really focusing the legislation to drive funding. So this is proposed legislation. It has not yet been passed. All of these bills that I just showed, none of them have been passed, but you can go to congress.gov and you can sign up for alerts if you want to know when a bill is moving to committee or how it's going. But I want to tell you, although the Midwives for Moms has not been passed, because of a lot of organizations who wrote these reports and consensus documents and advocacy, the need for midwifery education, that need for a diverse pipeline for midwives, there have been federal appropriation requests. There has been Title VII and Title VIII dollars that have come in the short term. And so that's really helpful. And we can demonstrate that that works. And here's a quotation from the Policy Institute for Community Birth that explains, there have been historic gains for growing and diversifying the CPM workforce. And since 2019, there have been these grants for midwifery accredited schools. and that we're getting what midwifery education should get. But the challenge is that it's not permanent. This legislation would make midwifery education permanently funded with permanent streams of funding through Title VII and Title VIII in the Public Health Service Act. And you can see some organizations below, and there's a whole list of other organizations that also support this. And they explain that this would provide midwifery students accredited midwifery programs direct support, expanding midwifery schools, securing the number of preceptors, prioritizing programs to increase minority student representation, and encourage the practice of midwifery in medically underserved communities. Okay, so very quickly, where are we with this? There is work to do for those who want to really understand of the different levers of policy work and federal funding. Even in my own state, we don't yet have some of our own senators, right? But there are some senators from other states, from Arizona, from Oregon, from Arkansas, Alaska. And at the US House of Representatives, there are states like, again, Arizona, Colorado, Texas, North Carolina. So you can go on congress.gov and you can follow who may be co-signing the support of this legislation. So what we just saw was a lot of federal pillars, but this conversation right now has been seeded thanks to the New Jersey Healthcare Quality Institute. And not only do I want to thank them for just a short, informative way of making visible some federal policy levers, but they have a report that was written by Magda Shaler-Haynes about 2 months ago that I hope doesn't just stay in your email or on a desk somewhere. This is a great report, and I want to quote that the information states that ensure autonomous midwifery practice have a more robust midwifery workforce that can attend more births and achieve better outcomes. And in New Jersey, as much as we need federal transformation, we also need state transformation. And you can read this report to look at some of the very iterative and critical reforms that are needed, and they can happen simultaneously. We can work for federal impact as well as state impact. And so let me show you what gives me hope about California and a call to action from whatever state you're calling in from. California just created a coalition, they're calling it Midwifery Access California. And it's a coalition for consumers, health plans, advocacy organizations, maternal mental health, social determinant programming with breastfeeding and doula care services. Anybody can come to this Midwifery Access California coalition. And this is their website. And I want you to look at their goals, because these goals are both what are happening and what we need at the federal level and at the state level. So let me just read to you their goals. Advocate and update laws, policies, and regulations for midwifery. Educate stakeholders about midwifery. Expand in-network access to midwives. Improve the contracting process between midwives and health plans. Create midwifery payment models to improve reimbursement. Grow the midwifery workforce and education pipeline. There is consensus around that, and there is so much work to do. And as we watch the federal pillars and we read the reports and we follow legislation, there's such opportunity on a state level. And I really appreciate the model that is delineated by California. And we know that coalitions work. Part of the US Breastfeeding Coalition and federal places like the PUMP Act, and you know, they really work in a coalition capacity. So I will end showing you a photograph of a book that I couldn't put down when I was the youngest of young children. I was born in 1973. And this book, called The Day You Were Born, was the book that I remember the most, that I loved the most, and was so torn up that there had to be masking tape put on the seam of it to keep it intact and together. And the day you were born was really interesting. You can find it on Etsy. I still have my personal copy of it. But it's really interesting because it actually talks about birth from the infant's experience and the capacity of the infant, and the infant-parent relationship. And the way that birth is portrayed in this book also really centers the physician, centers the doctor. And we know that there's a role in the landscape of maternity care. We need a strong coordination and collaboration with midwives and physicians. And we also need to recognize the midwifery model of care is unique and does need autonomy, as well as imagining a new way of giving birth for the United States, for families, for individuals. I'm excited to see that if you are a parent of young children, or if you get to work with kids in any capacity, have a waiting room in an office that you work in, you can find much more books about giving birth and being born for young children these days. And here are just a couple of my favorites that are all about midwives. Because when we recognize the midwifery model of care is a way of holding and attuning the transformation of families, we need all of the federal levers. We need all of the legislation, all of the reports, all of the funding mechanisms, and we need to hold the wonder and hope of midwives attending birth. So thank you for hearing me and having this conversation. You can find me on Instagram at Speaking of Birth. I have a part-time grant at Montclair State, so I have my email there. You can find me at my website. And thank you, New Jersey Healthcare Quality Institute. I think there's a Jamboard. I haven't looked at anything in the chat, so I look forward to, I will stop sharing my screen, except to say that you will get all of the resources that I mentioned with links.
Great. Thank you so much, Jill. Thank you for providing that overview on federal midwifery legislation. That really sets us up nicely to think about the next portion of our activity. We'll be completing a word cloud activity together in order for us to think about different opportunities that we can take to support policy. So very shortly in our chat box, we're going to provide a link to all of you to participate in our word cloud activity. You also can participate by scanning our QR code that we will make available on our screen in just a moment. So please feel free to kind of process just what we heard in our presentation. And we have our first question posted, which is, what is one opportunity that you can take to support or uplift any of the legislation that was mentioned in today's presentation? So in order to participate, please feel free to click on the website link. That will take you directly to our word cloud, or you can also scan the QR code using your phone that is posted on our screen. So we'll give everyone just a few minutes just to process and to submit your responses to participate together in our activity. So we have a few responses coming in. Staying up to date about current legislation and initiatives, having a town hall for communities that can benefit most from this legislation, learning more about the federal legislation that is currently out there, calling our rep's office, getting legislative alerts, contacting my New Jersey legislators. Another similar theme with staying up to date with the legislation that is currently out. Sharing this presentation with colleagues. Absolutely. As Jill mentioned, the slide deck and the recording will be made available. Reaching out to local legislators and following actions being taken on proposed bills. Staying more up to date with the legislation as it relates to expanding midwifery care and access. And then also calling and writing to legislators. So those are great responses. We'll give it just a few more moments for a few of the responses that are still trickling in. Also, please keep in mind that you are able to submit more than one response as well. It is very difficult to condense an answer that is very open-ended. Making sure that there is a political will to mainstream midwifery and birth centers. Great. Becoming involved in resolutions as well as legislations in New Jersey. Education for elected officials about midwives. Reaching out to schools to place midwives as a career path. That is great. And that is definitely one of the priorities that we've been talking about at the MIH Hub. And again, staying up to date with pending legislation. Contacting my state Medicaid agency about TMAH. Organizing legislative cards writing in my community. Culture shifting around relationship-based care as central to birth justice. And also expanding the midwifery workforce through increasing preceptors. And we'll end with this response, getting midwifery modernization law moving in New Jersey. Great. So there's a lot of consensus with a lot of action-oriented opportunities that we all can take just by generating ideas such as this. We're going to move on to our next poll question. And our next question is this: how can maternal infant health stakeholders continue to support midwifery practice? So again, same with our last question, please feel free to answer the question and then submit your response in order to participate in our activity. And again, you are able to submit a response by clicking on our link that is available in our chat box, or you can scan the QR code that is posted on our screen. And you're more than welcome to submit more than one response. So we have a few responses coming in. Opening our networks in order to deliver this information. Absolutely. Student scholarships, making sure the midwives have autonomous practice, supporting preceptors, federal grants and various funding opportunities, equitable reimbursement rates, advocating for funding to education and training to build the workforce capacity, focus on reducing barriers to obtain midwives, include midwifery as an option in discussions related to maternal infant health, absolutely. Giving midwives a seat at the table, all types of midwives. Allow midwives to practice independently instead of requiring collaborative physicians. Show up to board meetings to share our support of midwifery. Ending academic racism. Provide engagement opportunities and partner with TEC and early college programs. Provide more education opportunities to build the workforce. Raise more public awareness about the unique and important role that midwives play in the birthing sector. Legislation for community health / midwifery centers in local neighborhoods. And then also recognizing CPMs and CMs properly and by supporting community births, home and birth centers. There's another agreement with that, more birthing centers. We'll give it about just one more minute. Educating legislators on birthing centers. Again, more birthing centers. A lot of strong consensus with that one. Holding providers accountable who make access to midwifery care seem unsafe. And then finally, supporting systems change efforts to increase insurance reimbursement rates for midwifery services and develop sustainable reimbursement models for midwifery care. Great. So thank you so much, everyone, for just taking some time to digest and just for us to think about ways that we can support policy and also for other stakeholders to continue to support midwifery practice in New Jersey. We will also send these responses to all of you in our follow-up email as well. So with that said, we will transition to our Q&A segment and I will hand it over to Kate and also Jill.
Thanks so much, Armini. Yes, I've been monitoring the chat box and the Jamboard. And before we jump into questions, I just thought I would summarize some of the comments that have been made. As we are seeing throughout the chat, there's just a really significant importance to think about all of the types of midwifery, particularly as we think about the many different places across the US that people are giving birth, and particularly access in rural areas. The needs of a CNM may be very different than the needs and wishes of a CPM when we think about legislation. So that's important to, ask and know. Additionally, thinking about barriers of the collaborative agreement here in New Jersey and other states who have similar practice requirements, particularly in how that reflects on people being able to receive care where they want to, and also the ability to admit patients to hospitals. So Jill, a question did come in particularly about admitting privileges. Is there anything being done, through federal policy or federal legislation in regard to midwifery admitting privileges?
I would actually welcome others to join in and answer this. I as you heard from my bio, I am not a midwife. I hope this is a love letter to midwives, that midwives receive the parity, the reimbursement, the recognition, the full practice autonomy that they need. So if I'm answering something incorrectly, I would really defer to people who are here listening with their lived expertise and wisdom, and it may be different state to state. So the question was, and if I understood it, in terms of, is there any federal proposed legislation about hospital admittance? I don't think so, but I would welcome if someone else could help respond, and I can also look for that. But my immediate response is I don't think so. I think that's more a state by state issue.
Great, thank you, Jill. A couple of questions were posted on our Jamboard. And this might vary significantly, so I'll give that caveat before I ask. But do you know, has there been any research done to understand the primary demographic of consumers and patients who may be interested in midwifery care? Are there trends or patterns, or is it sort of across the board? Midwives.
Listening to mothers has been the first kind of listening to consumers that started probably about 15 or 18 years ago. And listening to mothers is now in a new iteration. So we're going to get some of that. But at the last listening to mothers, both nationally and then the one that was specific to California, there was very, very high demand for midwives from consumers. I don't remember the exact percentage. Again, a lot of American consumers don't understand the midwifery model of care. They don't understand the role and scope of midwives. So sometimes it's not until later in a pregnancy. I know teaching childbirth education, sometimes people start out not understanding the various pathways that people can have a skilled birth attendant with. And so then they find out as they go through their own education that they would want the midwifery model of care.
Thanks, that makes a lot of sense. A couple more questions, going back a little bit more to the hospital question, but really just thinking about all the people on this call today wanting to be advocates. Can you give any practical advice to people who want to advocate both locally, potentially to hospitals to continue to allow midwifery to practice there, but also as we're thinking about state and federal legislation, how can people feel more tapped in and able to connect with that?
If anyone is here from an organization like the American Association of Birth Centers, that's an example of a group that has these kind of call to actions for pieces of legislation where you put in your zip code and it goes right to your elected official. Every Mother Counts has an advocacy toolkit that is specific for the difference between state versus federal. So I can put that advocacy toolkit from Every Mother Counts in our follow-up. And then I'm also thinking of the March for Moms, which started in 2000. I forget what year March for Moms. Again, if someone's here from that, please feel free to put it in the chat. That was really designed to do this collaborative advocacy. So there are groups out there. I will tell you from a New Jersey perspective, we don't have what, so for example, Massachusetts just did a huge maternal health series of bills important for midwifery in Massachusetts. And they have something called the Bay State Birth Keepers Alliance, where it brings together all different consumers. We don't really have a consumer group in New Jersey, but we do have groups like ACNJ that really look at maternity care. So there are groups that are out there. It's just a matter of finding them, sign up for their email, and find out your state data. I mean, I spend a lot of time on the New Jersey Maternity Care Report Card, and it took, I mean, it's still outrageous that we didn't have public reported knowledge of episiotomy rates until 2017. You know, and it took our own female New Jersey state senators, and, you know, and at the state level to say we need to have more publicly available information on the experience of quality indicators. So that's something that we can do as consumers, is really look at the indicators from Leapfrog, from the New Jersey Maternity Care Report Card. But that doesn't always mean access. If there is a higher quality location, it doesn't always mean that the payment mechanism for insurance is involved. So this is why this is all of our life's work, because just when we think we have one pathway that maybe some resolution, there's all these other invisible forces that influence maternity care as well. So the work continues. And again, I hope that people can populate the chat with other organizations, specifically for that advocacy at the federal and state level.
Yeah, thank you, Jill. Yes, hopefully we have a growing audience today of advocates. Question came in regard to two of our largest teaching hospitals here in New Jersey, both University and Cooper. These sites do not have midwives who practice there. Should our state require that our teaching hospitals give midwives both admitting and delivering privileges?
I'd really want to ask a midwife to respond to that, because again, I feel like there might be some complexities, and it's, you know, I think we want physiologic, safe, high quality birth, and so I think that's kind of a deeper conversation about, is there even like freedom of movement or the ability to eat and drink in labor? And I would actually, maybe we can have a future conversation on that topic, and what is the way to make sure that we're supporting high value maternity care within teaching facilities, and also recognizing that the model of care that midwives offer is unique and different. So I'm open, and I see Linda's saying yes with exclamation points. So I would defer to her and offer her the mic.
Yeah, happy to have any of our midwifery colleagues come off mute and respond to any of these questions. And Jill, I appreciate you answering what you can and also deferring to expertise on the call. Here's another one, probably where multiple people can chime in. Would it serve midwifery to unify all types of midwives to learn, teach, practice, and advocate together to strengthen midwifery care and highlight the expertise of each type of midwife and their licensure?
Sorry,
Yeah,
you were unmuting. You were saying that we could unmute. Is that correct?
Yes.
I mean, I'm a CNM. I don't know that we should be learning together because we have different models of education, but I do think that we should be collaborating and working together. You gave a long list, like learning and working together and everything. So the learning part, I don't think I agree with, but the rest of it, absolutely. I think we would women would benefit, birthing people would benefit more if we were working together than if we kind of make tiers for ourselves.
Thank you so much for contributing, Shiva. Jill, I'll turn it back to you to see if you have thoughts there.
Yeah, I mean, I think we can learn a lot from the landscape of lactation, where in the landscape of lactation, we need everybody, right? Because some people in the landscape of lactation are going to literally be dentists that deal with tongue ties of newborn babies. And some are going to be mother-to-mother peer support, and some are going to be higher level credentials. And that's just a very quick summary overview. And I think in the landscape of maternal health, we also need all models and all points of access and synergy and integration. And so they are going to be unique and different. There's levels of maternity care. And so I think that there is opportunities to really learn and leverage with each experience in maternity care. And that's really the point, is making sure that safe, respectful care is the right person, the right facility, you know, and collaboration, I think, is really important with that.
Thank you so much, Jill. And thank you to everyone who's been so active today in the chat and on the Jamboard, both through your questions and your experience. Being able to share that together, I think, is what propels this work forward. Jill, you certainly have given us so much to think about and so much to hopefully look forward to on the federal legislative side. And I hope that we'll have the opportunity for everyone here to continue to cross paths as we advocate for access to all types of midwifery, both in New Jersey and across the US. Armini, I'm going to turn it back to you to wrap things up for the day.
Great. Thank you so much, Kate. I just wanted to echo Kate's sentiments and thank all of you for joining today's session. The slide deck and the recording will be sent out in our follow-up email, and it's also going to be posted on our MIH Hub midwifery resource page. Our resource page also contains slide decks and materials from our previous sessions, so please continue to review them and feel free to send it out to those in your network as well to continue our learning together. As Jill mentioned, the Quality Institute and the Burke Foundation released a midwifery report, which reviews New Jersey's licensing and regulatory structure, and it provides some recommendations that our state can take to modernize the midwifery profession. The link to that report has just been made available in our chat box, and we'll be sure to send that to you as well as one of our resources. Again, the MIH Hub has also been focusing on increasing the public awareness of midwifery as its priority. So the MIH Hub has developed a number of toolkits that is meant to be directed towards individuals and organizations in order for them to use and educate policymakers and consumers about the value of midwifery care. These toolkits contain key messages, social media posts, and also different graphics that communicate what midwifery is and how it benefits policymakers and consumers in order for them to understand and know about the value of midwifery. Please feel free to post these messages within the toolkits in your own platforms. You can also post it on behalf of your organization in order to promote more midwifery into your networks. Again, these toolkits are adaptable, which means that it can be modified with the hashtags and also can include your own graphics. Our toolkits are also available on our MIH Hub resource page. And as mentioned before, you will all be asked to take a brief exit survey in order to assess your knowledge of midwifery after attending the session. So please feel free to provide your responses. With that said, we just thank all of you for your time today and for just participating in this discussion about midwifery legislation.